go. I know there's a delay, so testing 1, 2, 3, 4, 5, 6. And this is the mayor's mic, 1, 2, 3, 4, 5, 6.
with me, of course, two familiar faces, Denise Fair, our Health Director, and Dr. Najiba Rahman, our Medical Director, who has been leading so much of our response, and Fire Commissioner Eric Jones and Jeff Gaglio, who have been central in the role of going into these nursing homes, going into these senior centers, and actually doing the testing that's made this possible. Before we get to them, I'm going to do a brief update again. The numbers that we always start with, we're reporting 1,128 Detroiters that we have lost since the beginning. We're reporting 17 more than yesterday, but of course, as you've come to understand, most of those are people who died some time ago, and the data system is just catching up with them. But 1,128 in basically 6 weeks is still something that's going to take us a long time to absorb. But the numbers, the trend lines, it was just a few weeks ago I was standing here talking about how long it was taking to double the number of deaths in the city. And we talked about the fact that we were trying to slow the rate at which they doubled. Now, again, you look at the weekly numbers from 258 4 weeks ago to 276 to 208, and now you can see they're not doubling. They're basically being cut in half every week. They went from 208 3 weeks ago to 127 2 weeks ago to 60 in the last 7 days. And this is what we want to continue to accomplish, is continue to push these lines down. We saw yesterday, out of our roughly 1,500 tests, less than 8% of every Detroiter whose test results came back was positive. We have not seen overall results of infection rates below 8%. The social distancing is working. And as I've said all along, the single biggest report card that we have in this city is the TCF Center. And those 1,000 beds that are built across the street this afternoon have one patient in them. So there's one occupied bed and 999 vacant beds. And when Lynn Terosian and the team escort that last patient home, I'm confident the TCF Center will go into mothballs. We are always going to have to be, at least for probably the rest of this year, conscious of a spark. And certainly if we go into if this summer there turns to be big crowds, it's going to spike back up on us. We can't maintain our discipline. When we get into the regular seasonal flu season in December and January, we're going to be at risk again. And so I'm sure the governor will keep the TCF Center in reserve. It was the right thing to do when our infection rates were soaring, but to be down to one person is a great accomplishment for everybody in this city. When we give you results of infection rates, it depends on the test being accurate. And you probably gather by now, I am obsessive with the testing process and the results. Most of our tests go to BioReference Labs in New Jersey, which is just absolutely outstanding. They're doing much of the New York testing. Some of our tests go to Garza Labs in Jackson. They've got a great reputation for testing prisoners. And we have been reliant heavily on the Abbott 15-minute tests. And so there have been some media reports at times about the accuracy of the Abbott test. And as we have talked about here before, every place where there's been a problem with the Abbott test, it had to do with the city storing the swabs in medium and transporting them in a way that didn't work. We have never done that because Dr. Rahman has been obsessive from the beginning in making sure we followed only the safest protocols. But the accuracy of the Abbott test is important. I was tested on the Abbott test. Denise Fair was tested on the Abbott test. Much of the fire department, almost the entire police department have been tested. And so obviously we believe that. Dr. Rahman, being a scientist, said, I believe it too, but I want proof. And so she knew there were reports out there about false negatives, that you don't want to test to miss people who have the disease. So a false negative means that the test says they're negative when the patient really has a disease. And certainly we've seen that in a number of hospital labs. And so Dr. Rahman decided to do a test on her own, matching it with the state lab, which is the gold standard in this state. And she took 50 patients who tested negative on the Abbott test, and she sent samples up to the state because she wanted to be confident herself that what she was directing us to do had every bit of science behind it. And she is formally releasing the analysis of those 50 cases. And with that, I'll turn it over to Dr. Rahman to talk about how she conducted this test and what the results were. Doctor?
Thank you, Mayor. Yes, so there were concerns about Abbott testing across the nation, and some of our internal team and CDC and MDHHS, the State Health Department, started to have discussions about doing a verification for some of the individuals that we were testing. And so we collected 50 samples from our DHD clinic, and we double swabbed those individuals. So we did one swab, and then we set aside another swab to send to the Bureau of Labs. Now, the Bureau of Labs have the gold standard for testing. It's also what the CDC is using, and so it's the best comparison that we could use. So we ended up having 49 samples that were sent. So we had our own results, and we blinded those samples. So that means that we did not give them any identifying information. We did not give them the results. We wanted to see what they came up with that gold standard of testing. So we ended up sending all negative samples, and that was really reassuring because these are high-risk individuals that were highly impacted even a month ago, and so those numbers have really come down. And we were really pleased with the results. We found 98% concordance, and so that means that we had 98% of the tests were in agreement between our results and the State Health Department's results. That was 48 out of 49 individuals. Now we had 1 out of 49 individuals that were indeterminate or inconclusive. And so we wanted to look into that, so I called the individual. I asked them if they were having any symptoms, if they had any exposure to any close contacts. They said no, they were feeling great, but we still wanted to make sure so that they could return to work, and so they were retested, and they were also negative. Now again, Mayor talked about those false negatives, and that's the biggest concern, because you don't want somebody who is positive continuing to work, and so we still want everybody to monitor for symptoms along the way, because the incubation period is between 2 to 14 days. And this is also great for the city of Detroit as we start talking about phasing in our employees, that we can feel more comfortable. And as the medical director, I feel extremely confident with the Abbott testing modality, and I think that we can continue to move forward and feel good about the direction we're going in. And in the meantime, we're continuing our surveillance with our nursing homes, our adult foster care, and our homeless shelters. And so we're really hitting every high-risk group from every angle at this point to continue to keep Detroiters safe. I really quickly wanted to touch upon some of the work we're doing with the nursing homes in partnership with the CDC and the State Health Department. So we already did one round of testing for 26 of the nursing homes in the city. And we decided to go back and retest 13 out of 26 of those nursing homes. We're now at 10 out of 13. We've received results for a few of those nursing homes, and this is very, very preliminary data. But I just wanted to underscore that these facilities had between 30 to 50% positivity in their residents, and now we're seeing between 5 to 10% of individuals that were negative are becoming positive. And I think this is very reassuring that our cohorting and our education and the PPE that the City of Detroit has distributed has been quite effective. And we're hoping that over time these numbers continue to go down, and that we can help inform decision-making down the road and overall infection prevention and control for our high-risk individuals. Thank you.
So Dr. Rahman has done a great job overall. It's tremendously encouraging that as they've gone back to these nursing homes a second time, we've seen that the nursing home leadership has taken the health department's recommendations very seriously, is doing a good job of separating patients. We're seeing the infection rates drop very steadily at the nursing homes. The Abbott test report is available on the health department's website. It's a 4-page report put out by the health department. And in simple terms, it's this: 49 people, mostly city employees, tested negative for COVID-19 in the health department test. 49 duplicate samples were sent to the state lab. In 48 cases, the state lab confirmed they were negative. In the 49th, they said it was inconclusive. I think the person who swabbed probably didn't get enough material on the swab for the state lab to read it. We retested, and in the 49th confirmed the Abbott test was right in the first place. And so we are bringing city employees back, in most part, by the 15-minute testing on the Abbott test. And everybody in my office is back on the job as a result of that test. I have confidence in it. But now with Dr. Rahman and the analysis done by the health department, we've got the science to back it up, and the public can review the details of the methodology in that report on the health department's website. The reason that Director Fair and Dr. Rahman were able to move through these nursing homes so quickly was because, in addition to the great support we had from Henry Ford and Wayne State, we had a trained team of EMTs from the Detroit Fire Department who went in and actually took a number of the samples and continue to take a number of the samples. And in the coming weeks, we are going to go through every single senior citizen apartment in this city the same way. But it wouldn't be possible if the Detroit EMS hadn't done this. And normally, our EMS service comes out when you dial 911. Eric Jones stepped forward and said, our team is trained to take samples. And so he had basically put people on overtime and sent them into these nursing homes, into these senior centers to accompany the health department. And Detroit EMS has been a huge part of protecting our senior citizens. And so with that, I'll turn it over to the Commissioner, Eric Jones.
Thank you, Mr. Mayor. I must begin today by saying thank you to the men and women of the Detroit Fire Department. They continue to show up and serve. Just today, we only had one sick call for both our fire and our EMS divisions. We are actually deploying more units now than before the pandemic. This availability speaks volumes to the dedication of our firefighters and medics and their deep respect for the citizens of Detroit. There are several critical tasks associated with this pandemic. The mayor requested that I assist the health department with two of these tasks: employee testing and nursing home/group home testing. I had to accomplish this without reducing the fire and EMS deployments. I approached Captain Jeffrey Gaglio, who is also the president of the Emergency Medical Services Officers Association, to assist me with these projects. Captain Gaglio and his team of lieutenants and captains stepped up and delivered excellent professional service. Mr. Mayor, with your permission, I'm now going to turn it over to Captain Gaglio to talk about the data.
I've never known you to ask my permission before.
Thank you, Mr. Mayor. Thank you, Commissioner. I appreciate that. From day one, when this started, before EMS crews were even inundated with the COVID response, Commissioner called me and told me he needed help, and we stepped up and we offered him support from day one. So far, working with the health department, we went into the 26 facilities with them. We were able to test over 3,400 patients that were living in these nursing facilities. We have a crew of 30 EMS supervisors that have worked tirelessly from day one that this outbreak started. Above and beyond the nursing homes, the very first priority for the mayor and the commissioner was they wanted a system put in place for City of Detroit employees that they could have their concerns addressed immediately, and that you would have teams that were able to respond to anywhere in the city to address city employees' concerns if they believed they had COVID symptoms. Within 23 hours, we had a plan in effect, and we had our first call for service. So far, we've assessed over 532 city employees, and not only have we assessed them, but our administrative captain, Captain Robert Olkowski, has been the incident commander since this started, we were able to not only test them, we were able to track them, we were able to refer them for testing from the health department, we were able to facilitate their return back to work, and just the fact that we called them daily to check on them, to let them know that we're here for them and if there's anything they need, and that was a big priority for us to do. The Commissioner and I were talking also moving forward, war is the mother of invention. Some of the things that have happened for the EMS division are so huge. We started doing telehealth because of this, where our ALS crews are now you can actually video conference with a doctor in people's homes. This is our doorway into community paramedicine, building this relationship with Ms. Fair and Dr. Rahman for the City of Detroit Health Department. So I want to thank you for letting us be part of this. And I can tell you that the men and women of the Detroit Fire Department EMS division are some of the most dedicated and brave that I've ever seen. And in my 16 years, I have never been more proud of this EMS division.
And Mr. Mayor, I would also like to add, along with Director Fair and Dr. Rahman, we can't forget Dr. Dunn, because this all started
No
at the
question.
fire department. We put all of the protocols and the protective measures in place, and we're able to share that with other departments. And it's been pretty exciting for our department during this time.
6 weeks ago, Dr. Rob Dudd was the medical director of the fire department, and he has since taken over the world. And he's too busy to come to these conferences anymore, but he's been a phenomenal asset. But I am just so proud to be the mayor of this administration. Last night, I did the racial Maddow show where she featured the testing done in Detroit. I haven't had time to watch a lot of this national TV, so I really don't follow what's been going on in the country. But the feedback I got in the last 24 hours is overwhelming, and I guess I hadn't appreciated that across this country, you've got the president blaming the states for not having enough testing, you got the states blaming the president for not enough testing. We didn't have time to blame anybody. With what's at stake for the African American community and the fatality rates, blaming was a waste of time. We just said, we're going to get this testing done, and you're hearing today. I know the Detroit EMTs never in their training thought there was a day they were going to be going through nursing homes doing swabs of patients. They pitched in and did it because we needed somebody to do that. And 6 weeks ago, Abbott's 50-minute test hadn't even been approved by the FDA. Now we've been pioneers nationally in how to use them effectively and get our police, fire, and bus drivers back to work. This team has been absolutely great, and one of the leaders in that entire effort has been our health director, Denise Fair. Denise?
Thank you, Mayor. It's hard to believe I started this role just about 9 months ago, and it's been really wonderful working with the entire team. So I want to first, my report is going to be really brief, but I want to start just by offering a few thank yous, a series of thank yous. First, I want to thank the City of Detroit. We've been getting, as the mayor mentioned, a lot of national attention, and that's regarding the great work that we are all doing. It takes a village, and I know the City of Detroit has become extremely accountable. We're all practicing social distancing, we're wearing our masks, and we're really supporting each other. So the reason why we're seeing the curve trend downward is because we are following the guidelines, and so I want to thank the City of Detroit. And again, the weather is just, it's getting nice. And so if you're anything like me, you're enjoying the outdoors. And so again, just remember to wear your masks and practice social distancing. I also want to thank Fire Commissioner Eric Jones and Captain Gaglio just for the opportunity to personally thank them and the entire EMS team for their continued support. It really has been a true partnership. We could not have done this without them, and they've been really helpful in mitigating the spread of the virus in this community. I think Captain Gaglio already mentioned all of the statistics, but we have administered almost 6,000 tests, and again, special thanks to the EMS team. And finally, I want to thank my team, Dr. Rahman and the Detroit Health Department. We have over 230 health department employees that are working to beat this virus, and we're still continuing to operate as a health department. There's still several services that we are continuing to offer. So I do want to personally thank my entire team for rising up to the challenge. So now to switch gears briefly, the number of cases for today include 9,562. And this number continues to increase because we have increased our testing capability. And unfortunately, as the mayor mentioned, 1,128 deaths. So let's continue to lift each other up, check on each other who are hurting during this time. The Health Department, we are finalizing a new strategy to address COVID-19 cases in senior home apartment buildings. I believe I mentioned yesterday there are 10,000 units across the city, and we are finalizing that strategy. It'll be available soon. I will tell you the strategy is going to be just as aggressive as our nursing homes, and again, it'll be available shortly. Also, we are continuing to diminish the spread in our long-term care facilities. Again, that includes our adult foster care and our group homes. We have completed testing at 24 of the 37 sites, and we will be finished by the end of this week. The infection rate remains around 10%. And again, we are on track to complete this process well ahead of the May 15th deadline. Again, we are being aggressive, and we are focusing really hard on addressing this issue. And again, I just want to thank everyone for being so supportive. And with that, I'll turn it back over to the mayor.
Thank you, Denise. And since we've got so many people sitting at home watching this in the afternoon, I want to take the opportunity, and I've been trying to give you a chance to actually see for yourselves the men and women who are running the city departments, because a lot of times you don't get to know them. And I'm going to introduce now the new director of the DDOT system. Angelica Jones has done a great job as the interim director holding the place together, and she's got a good job in another part of the country. But we went on a national search because I wanted somebody to run this system that could run a first-class bus system, could run the people mover safely. The safety of the folks riding around up on that elevated rail never leaves my mind, and I wanted somebody who had experience in rail. And I also think it's within the realm of possibility. Depending what happens in the national elections, there could be a national infrastructure bill that could have the potential for light rail. And so I wanted somebody running DDOT who was an expert in buses and an expert in light rail, so the city of Detroit is ready if the opportunity presents itself, whether it's on Jefferson, whether it's on Michigan. We're looking at a lot of different choices. So Hakeem Berry, our chief operating officer, did a national search, and one name was head and shoulders above everybody else, and that was Michael Oglesby from the Miami area, the South Florida Transportation Authority. He has been 30 years in transit, the son of a bus driver who was a leader in running the bus system in Boston, a leader in running the light rail system in Miami, and decided that moving to Detroit in the middle of a pandemic was the right career move. And I was a little bit concerned on March 17th when the drivers, as far as I'm concerned, legitimately chose not to go out that day and caused us to revamp everything we were doing. I was a little concerned that Michael would see this and say, what am I getting into? But it was just the opposite. I think he saw the way the men and the women at DDOT, once we dramatically improved our cleaning processes, closed the doors in the front of the buses, started to pass out masks and test our drivers, I think he decided this is where he wanted to be. So he's been on the job 1 week, and I expect him to be at the center of building a first-class transit system here in the city of Detroit. So I hope the people of the city will welcome Michael Oglesby. Michael?
Thank you very much, Mr. Mayor. For those who are wondering if the mayor's a smooth talker or not, he was able to get me off the beach in here in Detroit. So I've got a taste of that already. So I'll just talk a little bit about myself. I believe in the 3B principle: be good, be brief, and be quiet. So what I'll start out with is I've been in public transit, as mentioned, for approximately 30 years. I've managed light rail, heavy rail, paratransit, ferry service, locomotives. So if you want to even run a boat, you let me know. I can do that too. I have large system and small system experience from Boston, which had 1.2 million riders a day, all the way to California, with Sunline Transit Agency. We're the leader in alternate fuel technology, so I believe on being on the cutting edge of public transportation. I've done some consulting in between, and I've also ran the rail system from Miami. I was the deputy executive director running the rail system from Miami all the way to West Palm Beach. So I've dealt with a lot of capital projects. I've started them from the ground up. I believe in creativity. But more importantly, I think one thing that's happening here that we really have to focus on is the safety of the rider and the safety of the operators. So when we come in, it's not just going to be all innovation, it's going to be getting the base solid. Therefore, when things start opening up and people need transportation, public transportation will be set, ready to go safely. And ultimately, that's my immediate focus as we're looking. But there's a lot of opportunity, and that's the reason why I'm here in Detroit, and I'm extremely excited to be here.
All right, and welcome, Michael, and with that, we'll take any questions.
Okay, Mayor, we've got a number of questions. First, from the Metro Times, they're saying that the state is indicating it needs 100,000 to 200,000 tests to test 1 to 2% of the population per week in order to feel like they can safely open up the economy again. Do we have an estimate for how much testing would be needed per week or per day to do that in Detroit?
Yeah. Right now, we're testing about 1,500 a day. I expect to get that up to 2,000 per day. And we have a very clear plan. Right now, if you want to be tested, what we are testing in the city, of course, if you have a prescription and you have symptoms, you can get in without a problem. But every single person who is working in a job in Detroit can get tested now. Or if you're about to go back to work in a job, and a number of the auto companies are doing that. So if we can be in the 1,500 to 2,000 test a day range, I think we can safely get our folks back to work. We will announce tomorrow, because tomorrow the governor has opened up the construction industry, but we'll be announcing 6 private construction projects going forward, and we're offering to every private construction site to test all of their workers. So we feel like we are at the rate we need to be. We've got the relations with national labs and suppliers of kits to go faster than that. But right now, I feel very good about where we are. 1,500, 2,000 a day. You know, we still have to be doing close to a third of the tests in the state of Michigan, and we're just going to keep right on going, meet our own needs.
Okay, a couple of quick questions on the Abbott test from Michigan Public Radio. How many Abbott tests in total have been conducted so far?
Upwards of 7,000.
Okay, and how are we looking on supplies for the Abbott tests?
Another couple thousand came in today. So we have a contract with Abbott to deliver 1,400 or 1,500 test kits a week. We space them out at about 250 tests a day, and that's what we do through the week. And I talked to the CEO, Robert Ford, again today, and as soon as the manufacturing capability expands, I'm confident Detroit will be at the front of the line. So we have to be reasonable. We were the first in the country. Everybody has to get something before he can start to go through and double, and I understand that. He's been good to deal with. But we've got now, 15 machines, Doctor? So we got 15 machines. We run 8 all day with live people, and then we've been taking samples at different places and running them on the other machines without patients coming through. But we could easily double the number of Abbott kits as soon as the expansion of the test kits is available.
Okay. How many, this is from Crane's Detroit Business, how many essential businesses have had their employees tested so far, and what kind of positive rates are we seeing?
We've got, I'm going to say 400 companies signed up, and we're running through, at the fairgrounds today, we had 1,200 people, 1,200 employees running through the fairgrounds today. I don't have the list in front of me, but it's been grocery stores, it's now auto manufacturers, it's drug stores, the nursing homes, doctors' offices. We've got everybody at the TCF Center has been tested. So we're at a good pace. The construction companies we're starting to see in the last week because they're about getting ready back to go to work. So I noticed in yesterday's report, I haven't seen it today, but yesterday's report, a number of the construction companies started sending people through. So people have been very cooperative. All I know is we had an overall 8% positive test rate yesterday out of the tests that came back. And I don't know company by company, I don't have that information. All I get is a global number. The individual companies know what their particular employees' results are.
Okay, Cranes is also following up on the retesting at the nursing homes, and this is probably for Dr. Rahman. With a 5 to 10% infection rate of individuals who had previously tested negative, they're a little bit unclear on how that represents progress. So if you could explain that.
Yeah, so it's possible that before we were doing the cohorting, moving people around after we did our first set of sampling, that those individuals had already been exposed. And so now we have to really look at the floor plans and the map of the individuals before they had testing to afterwards when we moved people around. We gave PPE to the staff. We did infection control and education. And so, you know, we don't want to see numbers like 30 to 50% like we were seeing before. And so to me, that's reassuring because at least we have interventions and we know that those positives are going to be looked at more closely by staff. And so we can help prevent sending people to the hospital right away as well.
So if you think about it in these terms, we had, of course, some places that were 30, 40, 50%, as Dr. Rahman says. When they go through a nursing home and say test 100 patients, and we've been running on average 25 are positive, you could have a couple of patients who got the disease the day before we tested, and the viral loads are so low, you won't pick it up the first day or two. That's just the reality, and that's why Dr. Rahman's going back. If you came back and saw them testing 15, 20% a week later, it would tell you it's spreading at the same rate. When it's testing closer to 5%, I think there is a good likelihood that it was people in the very early stages. But the great thing about what the doctor is doing is she's going through every single nursing home, looking at the infection rates, looking at how they separated the patients, and tracking the practices to the results. So she's relatively early in the second pass-through, but I was very encouraged when I heard the numbers today, and Doctor, I think you are too.
All right, thank you. Question for Commissioner Jones. ML Elric from the Free Press wanted to know, how is it you're able to put out more deployment today versus prior to the pandemic, and what does that look like? Is it more firefighters, more firehouses, more EMTs on the street?
So more people are coming to work. Our sick call rate has dropped. I mean, 3 days in a row, we had 0 sick calls for EMS, 6 at fire, 1 today. Typically, we deploy 24 ambulances. Today, we deployed 27. More people showing up, more deployment.
Think about where else in the middle of everybody being sick do you have more people showing up for work than you had 3 months ago. The commitment of the men and women of the Detroit Fire Department is amazing.
Mayor, from Christine Ferretti at the Detroit News, she said that lawmakers from, I guess, locally and across the country have sent a letter to the Department of Justice asking it to have the Civil Rights Division investigate the local, state, and federal handling of COVID-19 response. Are you aware of it, or do you have any?
Don't know anything about it.
Okay. From WWJ, they want to know if, Mayor, if you've heard anything in regards to health systems being proactive in getting word out about appointments and medical checkups.
Yeah, you're starting to hear the ads on the air. It's an article in the Free Press of the News yesterday, the day before, where the hospitals are starting to make it clear that they have this. But I just heard an ad on the radio on the way over here for a hospital system saying, "Come back, we can care for you." So I think the hospital systems are responding. this is really hard to understand. You know, I was all over the country when I ran the DMC. The systems in southeastern Michigan are considered at a level very close to Boston and Chicago and Houston. You've got some of the great healthcare systems in America right here in southeastern Michigan. These folks know how to treat you and keep the infectious separate from the non-infectious. I think they are now starting to explain that again. It's what they do well, and I'm confident they understand the need to re-explain it, and I think they will.
Okay, shifting gears for just a moment, I know you've addressed this before, but Channel 7 is asking if you could talk a little bit more, again, about the impact of the casino shutdown, and if you think it makes sense to keep it shut down, and what the long-term prospects are.
You know, it's cost us $600,000 a day. I haven't complained about it a single time because the health of our community is more important than the revenue coming in. But Dr. Dunn has been working with the casinos on recommendations on what it would take to reopen. We certainly are following what Las Vegas is looking at as far as reopening. And will there be a point where the infection level is low enough in this community that you could go back and maybe have a quarter or a third of the machines operational with appropriate distancing and cleaning and masks, where you could restrict the number of people at a table game? I think those conversations will occur in the coming weeks. I think we are a long way away, 6 months, maybe a year away from the casinos operating the way we're used to seeing them operate. But I do think it is possible, and certainly I won't be recommending it to the governor until I have Dr. Dunn's sign off, and I know he's examining it right now. But I think you'll see in the coming weeks or months an opening of restaurants where maybe they use a quarter or a third of the tables, an opening of movie theaters where they're using a quarter or a third of the seats in the theaters, and opening of casinos where they're using a quarter or a third of the slots in the games. Something like that is in our future. Whether that's in our future in June or whether it's August, I can't tell you.
Okay. For Dr. Rahman, a couple more quick follow-ups from Michigan Radio on the Abbott testing. The study that you did that sent samples to the state, was that a double-blind study?
No, it was not. We already knew what the results were.
Okay. And they also want to know if we have an overall positive rate for Abbott tests. I guess I'm not clear on that question in terms of whether they mean...
Yeah, the answer is we do. I could look it up, and we could give it to you later, but the answer is yes. Every single day we get reports. So we can tell you that the nursing homes test 25% positive. We can tell you that DDOT drivers test about 6 or 7% positive, but we have the data for every single group. The private contractors going back to work tested a very, very low percentage positive, but we actually track the positive and negative test results by every single department that's done, and we have that information.
Okay, thank you. One quick question on the breakdown of the senior units that will be tested. I think you said 10,000 approximately, is that correct?
So there are 10,000 units in the city of Detroit, and we need to determine what the strategy is. Right now, there are 57 facilities that have active COVID cases, but we are still finalizing what the strategy will look like, and we'll have that available sometime next week.
Okay, and this is from ML Elric. He's wanting to know if there's any kind of a breakdown of what types of units those are. Are they all high-rise buildings or spread out?
I don't have that information available. I can probably get it to him.
Okay.
Yeah, we're putting that together right now. So we went in a logical order. The nursing homes are where the people tend to be the oldest, the most medically compromised, and kept the closest together. And that's why you've seen nursing homes across America have been the highest death rates. Then Denise Fair and the team have gone into the assisted living, some of the adult foster care that are somewhat better controlled, and then ultimately we go to straight up senior apartments, but the average age of somebody who's died in Detroit of COVID-19 is 75. And so we know where those folks live, and we are moving from most at risk, and ultimately we'll have a plan in the next week to get through every single senior apartment building in this city over the next several weeks.
Okay, down to our last couple of questions. From Detour to Detroit, they're wanting to know, for all of the testing that we're doing at the city, whether it's Abbott or at the state fairgrounds, is it being recorded whether or not the patients are symptomatic or asymptomatic at the time?
So at Abbott, we know. At the fairgrounds, we don't. I shouldn't say that completely. If you have a prescription, you are symptomatic. So I talk about this longer than anybody wants to hear. But for the first couple of weeks, we would only test you at the fairgrounds if you had a prescription. You had to be symptomatic to get a prescription. Now I would say 75 or 80% of our patients who come through the fairgrounds are people who are working essential jobs. They're nearly all asymptomatic. We don't specifically ask them, but by and large they are. At the nursing home, Dr. Rahman made it a point in each case to ask if they were symptomatic or asymptomatic, and because she was trying to figure out how is this spreading, and she came back with data that showed us that asymptomatic people were infectious almost as high a rate as the symptomatic folks in the nursing homes. And so if somebody wants a deep dive into the data, we've got spreadsheet after spreadsheet of data that all of us study continually because it drives our decisions. And I know Dr. Rahman would be glad to talk to you about this data for as long as you would like.
Okay, and I think this will be the last question for Commissioner Jones. WWJ wanted to know if your workers are having any issues with public not socially distancing from your workers when they're out in the field doing their jobs. I know much of the work requires direct contact, but other than that, secondary people, are they respecting the distance?
Nothing has been brought to my attention that anyone has been interfering with any of our field units.
Okay, that was the last question.
All right, thank you all very much.